So our webinar today with the Medical Schools Council is on preparing for medicine applications. It's a broad topic, but as everyone will be aware, quite a complicated one. So we've got some excellent speakers today. This is what we're up to. So this is the welcome. That's the bit that we're in. I'm then going to do some introductions to our fabulous panel. They've got some presentations for you, and then we have a Q&A session. Yes, haven't introduced myself. My name's Clare Owen and I'm a director at the Medical Schools Council. As I say, really good panel today. We have Rachel Greatrix from UCAT. So you'll all be aware of UCAT, hopefully, or you certainly will be by the end of this presentation. We have Dent from Keele Medical School and Sarah Benent from UCL Medical School. So a lot of expertise here today. So we're going to talk about the UCAT. Rachel's going to give you an overview and some top tips on how your students can prepare for that test. Then Gordon is going to discuss personal statements, what students should put in there, and also crucially, how do medical schools use those personal statements. And then Sarah's going to cover interviews, so the different formats that are available and some tips on how to prepare. Okay, I'm just going to plug our next webinar. So if you've got anyone who's interested in dentistry, and they certainly should be because it's a great career, that is going to be on the 2nd of June 2025. But without further ado, I'm going to pass over to Rachel. Thank you.
Hi, everyone. I'm hoping you can see those slides. I've had a thumbs up, so I will get going. So thanks for that intro, Claire. My name's Rachel Greatrix. I'm the Chief Operating Officer at UCAT. Today, I'm going to cover what the UCAT is and outline how you can support your students in their UCAT journey. All this information is on our website, but hopefully I can direct you to some key bits as we move through the presentation. The UCAT is an admissions test. It's used in selection processes by UK university medical and dental schools, and it was developed by universities to achieve greater fairness in selection and also to help them make more informed choices amongst their often very highly qualified applicants. Rather than focusing on academic knowledge, the UCAT assesses a range of cognitive skills, attitudes and professional behaviours which have been identified by our universities as being important for success as medical or dental students. The UCAT is a multiple choice computer-based test. Our candidates sit it at Pearson VUE test centres, which we have throughout the UK and internationally, and the test takes just under 2 hours. Universities use their candidates' UCAT results alongside other selection criteria such as academic grades and interviews to decide which applicants to make offers to. UCAT results are delivered directly to the students' university choices in November of each year. This slide shows a big list of all the universities that require UCAT. I think it is reasonable to say that all the medical and dental schools in the UK now require UCAT for at least one of their programmes. You can see a full list of those universities and the programmes that require the UCAT on our website. If your students are applying for 2026 entry to medicine or dentistry, they will need to sit the test in summer 2025 before submitting their UCAS application. This slide outlines some of the key dates in our UCAT test cycle. As you can see, the UCAT test window runs primarily over the summer holidays and then into September. So we do recommend that you start informing your Year 12 students or equivalent around March or April of this year that they're going to need to sit the test. This will allow them plenty of time to familiarise themselves with everything they need to know and get any support they need from their school or families to support that process. Your students receive their UCAT result well in advance of the UCAS application deadline so they can use it to inform their UCAS choices. Your students need to register for and book the test themselves. They do that through the UCAT website. The UCAT test fee is £70 for tests taken in the UK. You can support your students in this process by making sure they're aware of those key dates, which are published on our website. They are only allowed to test once in any test cycle. Every year we have a lot of candidates who leave booking their test until late in the cycle, and they don't leave enough time to prepare adequately. So again, we really recommend candidates are organised, book and sit their test early in the test window to avoid that occurring. Candidates entitled to accommodation in exams due to a documented special educational need or disability are usually entitled to access arrangements when sitting the UCAT. They need to get these approved before they book their test. And again, our website outlines how they go about that application, but they may need some support from their schools and or their families to make those applications. Similarly, we have an online system where candidates can apply for bursaries. We offer full fee bursaries to UK candidates from low income backgrounds, and they can provide evidence to support this from a wide variety of sources, some of which are listed on this slide. And more information about that process and the evidence required is included on our website. In terms of what's in the test consists of 4 subtests, verbal reasoning, decision-making and quantitative reasoning, together with our test of situational judgment. The UCAT differs from academic exams in that there isn't any subject-specific knowledge required, but we do recommend that candidates familiarise themselves or refamiliarise themselves with some basic GCSE level maths, such as fractions, percentages and ratios, which they may well need to use in the quantitative reasoning section. We provide candidates with an on-screen calculator. This is a basic calculator they can use to support themselves taking the test. And they also have a notebook and pen to assist with workings out. In terms of scores, our candidates receive a total score between 900 and 2,700. And a band in the situational judgment test. They are banded 1 to 4, with our band 1 candidates being the highest scoring candidates. You may be aware that the UCAT test structure has changed ahead of the 2025 test cycle, and from 2025, the abstract reasoning subtest will no longer be part of the UCAT. On our website, we have question tutorials which provide a detailed overview of each of our subtests to support candidates in their test preparation. So how do they prepare for the test? The best way to prepare for the UCAT is using the free resources available on our website. Our highest scoring candidates report spending around 25 to 30 hours on their UCAT preparation and starting at least 6 weeks before their test date. We are aware that there's lots of commercial training companies offering coaching in the UCAT. We are not affiliated with them and we don't endorse their materials. We also can't comment on the quality of their materials or the accuracy of the scores that they report to candidate. And we would advise you and our candidates to be very sceptical of the claims that these preparation companies make. We often come across very misleading information on their websites. We have several free preparation materials on our website, including our preparation plan, question tutorials, question banks, and fully timed practice tests. Unlike commercial providers, these questions have been developed by the same teams that develop the content for our live test. We are confident they are of the right format and of the right standard to support your students in their preparation. We've got lots of information also on our website about test day and tips with advice from previous high scoring candidates. All of our preparation materials have been fully updated, so you can start informing your students about these if they're asking about preparation already. In terms of results, our candidates get their results on test day. They're given a hard copy of their UCAT score as they leave the test centre, and these scores are also available through their Pearson VUE accounts within 24 hours. And they receive, as I mentioned before, their results in advance of the UCAS deadline, so they can use that result to inform their UCAS choices. Our universities use UCAT in different ways in selection. For example, some may have a threshold score which candidates need to achieve, whereas other universities may use the UCAT alongside other selection criteria in order to decide on the candidates that they're selecting for interview. So it's certainly worth your students researching how their preferred universities use the test to avoid wasting an application down the line. So thank you for listening to this. Just finally, maybe I can just flag 3 things that you can do to help your students with their journey. So check out our advisor resource page for the most up-to-date information. You can also sign up to our mailing list, and I'll probably put something in the chat around that before we finish today. And do contact us if there's any specific resources that would help you in supporting your candidates. Start talking to those students about the UCAT and signposting them in the right direction as soon as you're able, and help them to use their UCAT result to inform their UCAS choices. Thanks very much for listening, and best of luck to your students when they take the test this summer. Thank you.
Brilliant. Thank you, Rachel. That was super helpful. We've already got one really good question that I'm going to ask at the end, but everybody keep sending those questions in. Gordon, we're going to you now to talk about personal statements.
Okay, can everyone see my opening slides?
Great, thank you.
Okay, great, thank you. Now, personal statements are a bit of a hot topic for 2 reasons. One is the change to the personal statement format within UCAS for the next cycle of applications. And the other is about the ways that medical schools do or don't use personal statements in selection, which is important for prospective students to understand. So there's a key question of whether medical schools use the personal statements in selection. I know in a lot of places you will hear people saying, no, they don't, it's not something you need to worry about, but there's a lot of variation in how they get used. There are many that don't use personal statements in selection at all, and I'm going to come back in a moment to why it's important for students to put effort into writing them. There are some that will check personal statements quite late on in the process. So before they make an offer, they'll look at a variety of things about the students they think you're making offers to see if there's anything suggesting to them that may be a problem. So they may judge that there are red flags in a personal statement that would make them think twice about making offers to them. Some may use it within the interview, so it may be a source of interview questions if they want to talk about a particular aspect of people's applications, so say ways in which they have demonstrated ability to work with other people. For example, they may pick an example from the personal statements and ask the student to expand on it. Some, or at least one medical school, will use the personal statement in borderline decisions where, say, they set a threshold for GCSE scores or UCAT scores. They may look at people just below that and see, is someone here who has a really strong personal statement. There's quite a small number of medical schools, and Keele is one of them, that use it much more significantly. So where there will need to be demonstration within the personal statement that students meet particular criteria for them to progress to the next stage. So the 3 I've picked out here, and in a moment I'll show screen grabs of their web pages with links on. So I can talk obviously most in detail about how Keele uses it, but there are clear ways in which the University of St Lancashire and the University of St Andrews use personal statements. The key message to take from this is that students must research whether the personal statement is going to be used and what criteria are going to be assessed. One of the important reasons why they must do this is it may be that of the 4 they're intending to apply to, only 1 is actually going to read the personal statements in detail, and they will then know they can focus entirely on what that particular institution is looking for without worrying what the others are, because they're going to assess purely on UCAT and GCSE grades or UCAT alone or whatever. Where a medical school is going to use a personal statement in selection, then they need to know exactly what they're going to judge it on. And those 3 examples have all got fairly clear criteria on their website. There are a few places, this is changing actually, so I know Sunderland still do this, I'm not sure about others, where a supplementary form is sent out, where essentially they're asking students to write what they wanted in the personal statement, but quite often students don't put into the personal statement because it's not explicit in the UCAS form. Now, the change to the UCAS personal statement format in 2025, application 2026 entry does consist of a structured set of questions, but they're not necessarily directly aligned to the information medical schools are looking for. The students will need to understand how they need to respond to those questions. Now, if many medical schools don't use the personal statement in selection, then why do I think it's important? And for me, this comes down largely to, this is where students are summarising their case for selection. So they need to put down into a limited space why it is that they would be someone who should be selected to study medicine, become a doctor. In my opinion, if you can't do that in a 4,000 character statement, your case for selection is not sufficiently clear in your own mind. And the discipline of working on it to summarise that case for selection in the format of a personal statement is really useful. So it forces you to think about what your strengths are, whether they match the requirements of the course you're applying for at the institution you're applying to. This isn't just important for having a written statement that may then be forgotten about. It's also because it's making you think about what your strengths are and how they match the university's requirements to prepare you for things that they might review. Because to be honest, nobody's going to ask you in an interview how you prepared for UCAT, even though that's been a big part of how they've selected you for an interview. They're going to be asking you about the way in which you engage with other people, your approach to situations where you have to carry responsibility or work effectively in a team or communicate effectively and so on. So students need to be thinking early on about how they've demonstrated those abilities that they are going to be assessed on an interview. With those three examples that I mentioned earlier on, these are screenshots from parts of their web pages that show what's being looked for in terms of non-academic attributes and what specifically students should be putting into personal statements. Now, some of this text may be too small on your screen to read, and there's a lot of text there, so I'm not expecting you to read through it while I'm talking. The key point here is at the bottom of the slide, which is if you look at these three institutions and what they see in a personal statement, there is a lot of overlap. They are broadly asking for the same information in slightly different ways, and they're not going to be prejudiced against somebody because they've written it in the order in which one of the medical schools has asked for rather than the order in which that particular one has asked. Now, the things for students to be aware of where they are concerned about writing a single personal statement for multiple medical schools is that Oxford and Cambridge are likely to be looking for slightly different criteria. It's not easy to work out exactly what they are looking for, but to the extent that people can from various third-party sources, they may need to work quite hard if they're going to apply to Oxford or Cambridge and to another medical school that uses personal statements in selection. If their other choices are very UCAT based, that's probably going to be much less of an issue. Now, I've taken this slide from another webinar I did for the MSc a couple of years ago, which is about what makes a good medical student. And this is a broader thing about what makes somebody good as anything that they're going to pursue as a career or as a hobby or anything. And these are the kinds of things that need to be coming across in an interview, in a personal statement, in any presentation students are making of their suitability. So they need to know that they have evidence of their motivation for the particular pathway they're going to follow, their commitment to it, their ability to learn what's needed to do it well, ability to work with others, interest in the subject that's underlain by curiosity about it, ability to apply knowledge to various scenarios, to reflect on their experiences, to demonstrate that they can handle responsibility, make decisions, communicate effectively, and so on. So these are the kinds of strengths that medical schools are going to be looking for, and students need to be thinking about what evidence they have, that they have them, and then looking at what's being asked for in medical schools, summary of what they want to see in personal statements, and think about how they've demonstrated these various things. And these align quite closely to the General Medical Council's outcomes for graduates, where they have these in a hierarchy with professional values and behaviours at the top. And it is how students have demonstrated those values, behaviours consistent with values, approaches to learning and engagement with people that's going to demonstrate their suitability for medicine rather than for purely academic study. Now, this is taken from the UCAS preparation site. So this is showing you what the new personal statement format looks like. So it's these three separate sections. Personal statements will still be a maximum of 4,000 characters, but they now have to write a minimum of 350 characters in response to these questions. What medical schools are looking for in the answers to the questions is probably going to be much more skewed towards the last question here rather than to the earlier two, and probably least to the middle one. But they don't have to write the same amount in each box, but they are required to write something in each of them by UCAT's requirements. Now, there's some stuff here that I've swiped from UCAS slides. They use this acronym PEEL for writing about experiences. So the point you're trying to make, what evidence you have to support it, expanding on that, and then showing how it applies to the career you want to follow. I'm more used to seeing things in the STAR format where they talk about where they were, what they were asked to do, how they went about doing it, and what they achieved. But students need to be thinking about these full stories either way. My summary of how to approach writing a personal statement is most importantly to remember it's a personal statement. It's about the person applying. It's not an essay about medicine. And I can guarantee if you ask them to write an essay about medicine, they will get artificial intelligence to do it. A personal statement can't so effectively be written by AI because it hasn't got the information about it to be used for it. Students need to understand what the demands of medicine are, so they need to have an understanding of the career and the study, but they need to be able to demonstrate why they are suitable for it. The real focus is about what their strengths are that are relevant to the career they want to pursue. Difficult thing they can find is they won't have space to write about everything they've done. And they do need to be able to pick the strongest examples of the attributes they want to demonstrate and cut out stuff that doesn't demonstrate that so strongly. So there's something that creative writers talk about called killing darlings. Sometimes you've got an absolutely fabulous piece of text, but it does not fit your story and you have to cut it out. And students will have sweated blood to get clinical work experiences, but it may not actually tell us anything useful about them, and they may have to resist the temptation to write lots about it. Other thing they need to think about is to make notes about the points they want to get across before they start writing. Otherwise they'll write something that's far too long and they'll really struggle to edit it down. They need to start from the key points and then build up, and then try to avoid writing some stream of consciousness stuff like Finnegan. So, sorry, that was very rapid, but I will stop there. Let Sarah talk about interviews, then we'll deal with questions later on.
Fantastic. Thank you, Gordon. I thought that was incredibly thorough. And you got a lot into that short time period. Sarah, do you want to pop your presentation up?
Absolutely. I think we segue nicely into my presentation about interviews, because very much it is about using your personal statement and that process of writing it and why you want to study medicine to then help you with your interview process. So this follows on beautifully. So I'm Sarah Benent. I'm the admissions tutor for the medicine programme at UCL. I did my medicine interview 28 years ago, I've just worked out, which is terribly long time ago now, but it's something you remember for the rest of your life about how you prepared and how you performed in your interview. And I hope that some of my experience, but also my experiences of being an admissions tutor and having interviewed quite a lot of students over the 8 years that I've done this now, can just help give a bit of advice. So the first thing that I want to say, why do we interview students? We've already said to you, we use the UCAT to help us to stratify students and to identify those students that have got the aptitude for medicine. So that is helping us in one way. But there are more things, aren't there, about being a doctor? It isn't just about the ability to do well in a test. It is more than that. There are interpersonal skills, there are values that Gordon was just talking about, that we want to know that students understand what those mean and what does it mean to work in a healthcare setting. So I think there are two main reasons why we interview. One is that we have huge numbers of incredibly eligible applicants every year. And unfortunately, we can't admit every single one of those to medical school. We have very capped numbers in the UK. So we have to make sure that we are selecting the best, probably in inverted commas, people to become doctors, those that realize what it is to be a doctor, they've done their preparation and they know what they're getting themselves into. And we're there to assess those non-academic interpersonal skills and the values that are necessary to work in a healthcare setting. There are different types of interviews. Now, on the whole, you will find that medical schools across the UK run what's called multiple mini interviews, and I'll talk about what those are. But there are a few medical schools out there that still run panel-based interviews. So I know Queen Mary and King's College London both run panel interviews still. And Oxford and Cambridge have their own interview and selection methods too. And Edinburgh and Southampton talk about selection days, where there are a couple of interviews or several interviews over a half day and where you come and visit them in person. And so it is for them and it is for the candidates as well to find out whether they actually like being at that university. And on the left there, online versus in person. So quite a lot of medical schools, in fact, every medical school went online during the pandemic. And for many medical schools, that worked quite nicely. And so they have continued in that method. For many medical schools, they've gone back to being in person. And so there is a variety out there. And again, as Gordon mentioned, students do need to do a bit of research into the medical schools that they are applying to so that they are fully aware of what the process will be on application. So multiple mini interviews. So a lot of medical schools have used these for the purposes of for students and for the medical school. So for students, there are a variety of different interviewers they're going to meet. Each station is independently scored. You can demonstrate a lot of attributes and behaviours over that testing time, and it has a series of standardised stations. So there is some face validity in terms of the students coming to the interview itself. What is the value for medical schools? Well, it's giving us multiple opinions about that student's suitability for medicine. It covers many different attributes and behaviours. As we said, we map all of our interviews to NHS values, to outcomes for graduates, to the attributes and behaviours we feel that are needed to study medicine. And it is a longer total interview time than some of the panel interviews. And so that's the majority of reasons why lots of medical schools have moved to this format. And in fact, across the world, quite a lot of universities use MMIs. And what do we want to see? So I've put a QR code here for the link to the fact sheet that Medical Schools Council have helpfully prepared. And I would really strongly recommend that students and teachers and advisors look at all of those resources. They're freely available. They've been made by MSc in conjunction with admissions tutors and universities to try and distill all of the necessary information into one place. And they are very helpful. So medical schools want to see at interview, can students communicate with us? Can they talk to us about their passion for medicine and about the preparation that they've done? And so that is one thing that certainly teachers can help them to prepare with is their ability to get that across to us, their attitudes. And so those values that we were talking about, what do they know about them? And why is it that I, as a person, want to see a doctor who is able to be caring, is empathetic, kind, diligent, etc. Their motivation to be a doctor. So that might well be a station. Why do you want to study medicine? Tell us more about it. And not in a rote learned robotic way, but in a personable way of why is this for you, the career ahead of you? Previous caring experience, so that's work experience in another format, because we do say that work experience doesn't have to always be medical. It can be a variety of ways in which they are advancing themselves and learning those attributes and skills. Knowledge of what's happening in medicine. Are they interested? Are they keeping up to date with medicine and healthcare and what's going on out there, because it's changing every single day? And Gordon's mentioned some of these attributes already, what makes a good doctor. And there is a Medical Schools Council PDF for that you can go to, where there is that list of attributes and behaviours. And most of MMIs and panel interviews are looking for students to be able to demonstrate their understanding of these, not just the Googled quotation about what does honesty really mean or what does empathy really mean, but a genuine understanding of what those are and where they've seen it demonstrated and why they think that that is important and why and how are they going to demonstrate it in the future. So MMI circuits tend to be separate stations that run sequentially one after another. Some medical schools do them for 5 minutes, some do them for longer than that. Some have preparation time outside where they see the station title. Some have no preparation or rest time outside before they go in. So again, each medical school runs their multiple mini interview in a slightly different way. So my tips include, please say to students that they need to be themselves. We want to hear about them as a person and advise them to avoid those rote learned answers. They need to listen. Listening is part of communication skills that we're looking for. Listen to the question and answer the question that is asked. Use their own experiences. So again, use that experience of writing their personal statement to be able to help inform their interview practice. Take their time to think and answer. Be honest, even if they don't know something. A lot of the interview questions are about opinions and how they are able to come up with an opinionated answer on the spot. And so I would suggest they imagine having a conversation with their teacher or mentor and to practice in that sort of way. And they can show their passion, demonstrate why they think they will make a good medical student. So how you can help? You can encourage them to develop their skills and attributes. You can help guide them through their work experience. You can help them set up mock interviews. And again, Medical Schools Council have helped to put together a mock MMI where there are stations available that you can easily just run. Think about the healthcare in the news and reflect upon it. Talk to them about dealing with nerves and anxiety on the day, because that can be a really big thing if it's the first time that they have met doctors, nurses, healthcare professionals in a healthcare setting. And I've put there about what to wear. Talk to them about that. It is an interview and there are ways in which to show that you are coming across as somebody who is prepared for that interview. And I've put here again, lastly, the Medical Schools Council resource, preparing for your interview. So you can log in there. Students can do the 30-minute exercise that's on MSc website to help them through the interview process. So happy to take any questions about interviews.
Absolutely fantastic, Sarah. And I just had a bit of a reflection while listening to this, in that if you've done recruitment yourself, or if you have been interviewed, you absolutely have the skills to help your students. It's not something magic that's happening at medical school. It's just generally what you'd expect if you were going for a job yourself, or you were, interviewing yourself. What would you like to see? I think that, sometimes people overthink it. It's just, the ability to answer questions in an appropriate manner. So I'm glad Sarah nodded, because I'm glad that I haven't got off piste with that one. But let's go back to personal statements. But I think this also applies to interviews, actually, because the question is, could you give some examples of red flags in personal statements? Gordon, do you want to head off on that one?
It's a little bit difficult because it's something I hear other admissions tutors saying without them ever giving examples. I think the most obvious thing is there are places where if the personal statement is clearly written for a different profession, so somebody's written a personal statement for accountancy and then applied to 4 medical schools that don't use personal statements in selection in any other way, they might read that personal statement and say this person's not committed. I think otherwise it would be evidence of something that's very troubling as an attitude of somebody who's aspiring to be a doctor. So you'd have to be fairly dim to put something like that into a personal statement, but I think it does happen. So people just giving away that their motivation is very, very questionable. I can't give any examples because I haven't seen them myself. I've seen examples in references, but I haven't seen them in personal statements. So I don't think this is something that happens often.
So unlikely to happen in a personal statement, but I would suggest, Sarah, slightly more likely to happen when people are under pressure in an interview.
Indeed, and I think that's exactly right, Claire. It's the pressure, isn't it, of an interview, and that's where teachers and advisors are so helpful to think about making sure that students think before they speak in an interview setting. And it's exactly as Gordon said, it's the troubling attitudes and values that are opposite of what we would be hoping to see in our future doctors, and that is being demonstrated in the interview answer. So it's, from my perspective, it's very rare that happens. Very, very rare. But occasionally you might get an interviewer that would say to us afterwards, that student perhaps wasn't showing that attribute to us, or they were showing it in a slightly bizarre way to us. And so it does come up at an interview stage. And I think often it is nerves and often students feeling that they have to say something quickly, and they say the first thing that comes into their head. So do take your time when answering the questions.
I have seen in interviews overt misogyny is not as uncommon as it should be. And people expressing opinions on different groups' right to healthcare. So people who would make prejudiced judgments on whether somebody actually deserves to be treated. Their opinions you can't do anything about. It's the professional behaviour of those opinions are things you should be keeping to yourself.
Yeah, entirely. Doctors have to treat everybody. And part of being a good doctor is being accepting that people have a range of different beliefs and lifestyles. That's in good medical practice. I was reading it this morning. Rachel, we had a question about what sort of, if you've come across any tips for students for whom English is not their first language, for that verbal reasoning part of the UCAT test.
Yeah, I think we do some tips on our website around this. I think it would be, I mean, if they kind of have a look on our resources, and they will see the kind of types of text that we cover in the test. They tend to be written, I mean, there's a real variety of how they're written, but they tend to be written in a reasonably formal way. A lot of them are taken from press articles that form the basis of it, for example. So I think my best suggestion would be to be reading articles in you know, reasonably quality newspapers, in perhaps in, you know, magazines, journals that are relevant to the subject, because that will help with some of the other stuff that we've discussed as well today. So yeah, the verbal reasoning can be more difficult for candidates in that situation, but the verbal load isn't massively challenging, but they do need to get used to being able to read through that reasonably quickly, make sense of it reasonably quickly, and interpret the question reasonably quickly as well. So a lot of this is down to the kind of practice that all our candidates are doing. But yeah, probably the best thing, read some newspaper articles, focus on health stuff, because that's going to help with your interviews, as Sarah identified.
Gordon or Sarah, anything to add? Sarah?
Yeah, I mean, I think it's obviously the reason that we do this and do the UCAT test and do interviews is that there are some necessary skills that are needed to be a medical student. Right from day one in many medical schools, you've got clinical experience coming in much earlier, and you're going to be in the NHS, you're going to be speaking to patients, speaking to doctors. And so these are the reasons why we are assessing some of these skills. And so I think it's important that if students are struggling in that way, that they do get some practice. And of course, for students overseas, we do require English language tests at a certain level, and it's usually a higher level than most other degrees at the university.
Gordon, I think you were going to come in there.
Yeah, I think Rachel's point about the nature of the text is significant, because clearly reading at speed is going to be an issue for people who don't speak English most of the time. But we're not asking them to read Henry James. It is kind of newspaper level text. So it's something that they should be able to cope with. It may just be a matter of speed. And sometimes people just have to think, I'm going to get better at this. I may not be quite there yet, but I will be in time.
Those sentence lengths in Henry James. With changes to the UCAT this year, are score boundaries likely to change compared to previous years? Will it be more competitive than previous years or similar, do we think? Rachel, do you want to? I mean, I'm not sure there's an answer to this one, but
I'll kick off with this. So I sent an email out yesterday, in fact, to all our universities to advise them of what historical data might look like had we not had abstract reasoning in the test. So universities, and we've actually published a page on our website, which actually shows that historical data to inform our candidates as well. So there's a link on our website to the test statistics from 2024, and we've updated that up. Thank you, Rachel, the other Rachel, with the test statistics for 2025 to inform those candidates. So yes, those ranges are changing. So previously we had a range from 1,200 to 3,600 in terms of total score. This year, that range will run from 900 to 2,700. We're all getting used to that. And trying to remember that we've only got three cognitive subtests as well. So that information is there. Our universities are going to have to change the way that they use the test, especially if they provided thresholds in the past. But there are ways that they can translate their old threshold over into the new threshold, which should be kind of a reasonably accurate process for them to undertake. I don't think it should get more competitive as a result of this. It just, I think we need maybe a year or so to transition, and by then we'll have forgotten that the numbers changed at all. But yes, there is information on our website, and just I think we always have to remember that actually the vast majority of the people taking the test this year didn't take it last year, and therefore for them it's nothing new. It is what it is, and they're going to deal with it in this way. So they should not see any kind of changes or struggle with that.
Gordon, I've seen you on mute.
Yeah, we have done this before. There was a cycle around 7, 8 years ago when there were only 3 cognitive subtests because something we used to have called decision analysis got removed before the decision making got brought in. In terms of competitiveness, there's no suggestion interviews are going to start doing fewer interviews. So that is what would make something more competitive. I think if an individual student is way, way stronger on abstract reasoning than on everything else, it's going to make it harder for them. But that's the only way in which it's going to become more competitive.
Sarah, anything to add?
No, I mean, I think for a lot of medical schools that, UCAT is used in a ranking sort of way anyway. And so it's ranking from a slightly different top score. We'll still, I'm sure, see the percentiles that we've been using before anyway. So yeah, I mean, as with every test, just do the best that you can.
Yeah, absolutely. Sarah, I'm going to stick with you. Are personal statements likely to have a greater importance in terms of recruitment with the new changes and 3 questions, or are you going to carry on doing what you normally do?
That's a really good question. I think from our perspective, we are going to see how things pan out with the personal statements. We're not at UCL, we're not going to be making any changes to our processes at this point. But we'll see whether those personal statements become more specific and whether they can be more useful within our processes. But as Gordon alluded to, there are reasons why medical schools decided to move away from them in the first place, because we knew that some students had a lot of help with writing their personal statements and others perhaps did not. And so I think we've just got to see how it goes.
I'm going to ask my own question, just to be, so it was a discussion that I was in this morning about ChatGPT, and I think the conclusion that the people on that conversation had was it's okay to use it, but don't make it obvious. So you can really tell if it's been used. I think as a reader, I've read a lot of application forms where I've seen it. Those words are not used in the normal English language in the frequency that ChatGPT will use them. Gordon, I know that you will have looked at a lot of personal statements. Any reflections on that, just so that the teachers are aware what to look out for?
Okay, so I've scored 350 so far this year. It comes down slightly to how we decide what we're going to assess them on. And because the emphasis is on what students have learned from their own experiences, what artificial intelligence writes for them generally is not very good. And to be perfectly honest, what teachers write for them is not very good. The worst personal statements we see are ones where clearly they're following somebody else's guidance and not telling us what we've explicitly asked them to tell us about. So I think with it's not just ChatGPT.
It's not just ChatGPT. Other AI is available.
I think students may need help with making text flow, making it grammatically correct and so on. I'm not sure all AI tools actually do that. Most of them will improve their spelling and punctuation, and that's okay as long as they read it carefully afterwards to make sure that the sense of it hasn't been changed. Because I have a bit of a bugbear about students who use words they don't know the meaning of and actually end up saying something completely different from what they intended. So yeah, they need to be very, very cautious, and asking an AI tool to write them a statement from scratch, it will come out so generic that it will not make a good impression.
Sarah, anything to add of you?
Yeah, I mean, I totally agree with Gordon. It is that the emphasis is on personal, and that's what we want to see. And that's, a lot of medical schools do use it. Some medical schools do use your personal statement as part of the interview. So if you have used AI to generate something and it's untruthful, then that is a significant concern. And so that would
Absolutely.
be a red flag to us. I mean, obviously, we are looking for students who are able to demonstrate integrity, probity, trust, honesty. And so those are all sort of demonstrated through their use of their personal statement and when they come to interview as well.
Brilliant. Thanks, Sarah. Gordon, did you want to make a further
No, I was
point?
going to say there is an apocryphal story of a candidate walking into an interview and they'd written in their personal statement they had grade 7 trumpet and there was a trumpet on the table and they turned around and walked out. But obviously that didn't happen.
No.
But
Be good if it did.
applicants greatly exaggerating things they've done may trip them up if they're asked to talk about it in an interview.
Yeah. Rachel, we've got a question about reasonable adjustments and access requests for UCAT. What's the process that students need to do for that? Oh, you're on mute.
Oh, I was doing so well as well.
Yeah.
There's a section on our website dedicated to the access arrangements and accommodations that we have in our test. Broadly speaking, the majority of our candidates that we support with access arrangement will get 25% extra time in line with the kind of support that they get in school and college at the moment. And a lot of our candidates also get rest breaks in line with those that they would receive in school or college. Candidates can provide different types of evidence to support that. For candidates that are in school and college, the most common evidence would be a letter from their school and college that meets the requirements on our website. So it sets out what their disability is, what they currently get, and we will then match that within the UCAT. But we do also offer some advice on there for candidates with more complex needs and complex evidence as well. So there's lots of information on our website, but we are able to kind of generally meet the needs of the vast majority of our candidates who are receiving support in school and college at the moment.
Fantastic. Thanks, Rachel. We've got a question about the new personal statement format and how you rationalize the number of characters you have in total over the 3 boxes. People think that maybe perhaps there's more to say in the final 2 than there is in the first one. Any advice on that, Gordon?
Yeah, I think this is something that students are going to find difficult.
Yeah.
And they need to be looking for any advice that's given by the medical schools. I'm just going to post something in the chat. So Rachel had a link earlier on to our webpage that shows the criteria that we're assessing personal statements on. This is a statement that's at the bottom of that page. And it is making the point that we have 5 criteria we're going to assess people on, and the last 2 of them are given the greatest weighting. And they're ones that we would expect to be covered in section 3. Most medical schools are not really going to be looking a lot at what's in section 2. The reason we've changed our criteria for 2026 entry is because the criteria we used to use would not have addressed anything in question 2 at all. And we felt that's unfair on applicants because they have to write something in it. UCAS requires them to. So we've changed our criteria slightly so that we are giving credit for something that would be in there. But they need to read carefully, what are they being asked to demonstrate through the personal statement? Most of that is like predominantly in section 3 for any kind of course that leads to professional registration. To some extent in section 1, probably section 2 or question 2 is going to be the least important. Except for Oxford and Cambridge. Always have to say that.
I mean, yeah, maybe they're a separate webinar. Sarah, do you have anything to add to that, or no? That's fine. Okay, well, I'm going to draw it to a close then. I don't think I'll just double check I've not got any more questions that I'm meant to be doing. No, brilliant. So thank you so much.